This week and next week we're going to be specifically looking at medications surrounding the nervous system, and we've broken it down into the two main parts, the peripheral nervous system and the central nervous system. So this week's topics are those medications that we use when we're interacting with the peripheral nervous system. So hopefully you've gone through and done some review of your anatomy and your physiology, so you kind of have a good basis as to where we're starting with these medications. Part 1 of this series is going to deal with medications that specifically affect the sympathetic portion of the peripheral nervous system. Recalling the sympathetic portion is that fight or flight response that we've learned about in our nervous system that allows us to respond to stimuli very quickly and react. So our objectives during this part 1 is that you should be able to describe the main pharmacological effects and the uses for alpha adrenergic drugs. You should also be able to describe the main pharmacological effects and uses of beta adrenergic drugs, and then give us the clinical indications and adverse effects with alpha blocking drugs, and the same clinical indications and adverse effects of beta blocking drugs. Quick little background and review here on norepinephrine versus epinephrine. Both norepinephrine and epinephrine will increase sympathetic activity. So they will both stimulate internal organs and increase the activity of the sympathetic nervous system. Now, although they both are adrenergic neurotransmitters, there are some important differences in the effects that each produces. Norepinephrine and epinephrine both stimulate the internal organs and increase that sympathetic activity. But specifically, epinephrine will relax smooth muscle, and norepinephrine will not. And epinephrine will promote bronchodilation, that is expansion of the bronchioles, another effect that norepinephrine does not have. So as we're talking about the sympathetic nervous system, it is filled with what are called adrenergic receptors. And since we've already identified that norepinephrine and epinephrine are the primary neurotransmitters in the sympathetic nervous system, they are also received by adrenergic receptors. Since we know that we have differences between norepinephrine and epinephrine, we've then been able to identify that there are some adrenergic receptors that will respond to norepinephrine and some that respond to epinephrine. So knowing this has allowed us to further define more specifically adrenergic receptors. In doing that, there are a number of them, but the two primary ones that we deal with, particularly in pharmacology, are that of alpha adrenergic receptors and beta adrenergic receptors. So alphas are found predominantly on the smooth muscle membranes of arteries, veins, and those sphincter muscles, those round muscles that contract, that are located in the urinary system and the gastrointestinal tract. Beta receptors, on the other hand, are found in cardiac muscle and also in some other smooth muscle membranes throughout the body. So now we know kind of the difference between the alphas and the betas. Let's take a look at the medications that stimulate alpha adrenergic receptors and beta adrenergic receptors. Adrenergic drugs are the ones that will interact with those alpha adrenergic receptors. Norepinephrine is considered to be the parent drug for the alphas. And so the alpha drugs have very similar chemical structures to that of norepinephrine. So the effects that norepinephrine would have on the body are the same effects that an alpha adrenergic drug would have on the body. The most important of these effects that we focus on with these medications is the therapeutic effect of constriction of smooth muscle. And if you remember, we said the alphas are located in the blood vessels and the sphincter muscles. Also, they're located in the ocular muscle of the pupil. So, if alpha adrenergic will constrict those muscles, we can affect those disorders that affect those muscles. So, clinically, common places that we would use alpha adrenergic drugs are hypotension, because we want to constrict the vessels and bring the blood pressure up. Nasal decongestion, because it does constrict, again, those membranes. It decreases the amount of fluid in those membranes. So primary uses are hypotension and nasal decongestion for alpha adrenergic medications. Now, if you think about it, the main adverse effect would be, okay, what would be if we gave more of this than the body needed, more of an alpha adrenergic stimulator than the body needed, and in which case we would cause the absolute reverse and cause us to go overboard with our therapeutic effects, in which case the primary thing that we will see as an adverse effect is that of a hypertensive crisis. We overdo it, we give too much stimulation, and now we end up with blood vessels that are very constricted, sending the blood pressure through the roof. The other thing that can happen is we can also see cardiac arrhythmias occurring with these medications. Those are irregular beats that happen. In addition, we may also see with looking at the nasal decongestion piece, commonly you will start to see, you may see irritation of the sinuses, and or with the eyes, because you get excessive dryness going on in those sinuses or the eyes, because again we're constricting the vessels and therefore decreasing the amount of fluid to that area. A couple examples of alpha adrenergic medications would include neosynephrine, which is pictured at the bottom and you may be familiar with, Sudafed, another one you might be familiar with, and then one from your drug summary, which was Levophed. All three of those are considered alpha adrenergic drugs and produce norepinephrine stimulation within the sympathetic nervous system. Now, as we said, we have two types of receptors. We have alphas and we have betas. So we talked about the things that will stimulate the alpha receptors. We're going to take a look at some of the things that stimulate the beta receptors, in which case beta adrenergic drugs. So now we said norepinephrine was considered the parent drug or the parent class for the alpha adrenergics. As a result, epinephrine is considered to be the parent drug for the beta adrenergics. And so beta adrenergic medications have a similar chemical structure to epinephrine. The most important mechanism of action of beta drugs is the stimulation of the heart and bronchodilation. So therefore, we use beta adrenergics in cases where we want to pick up the heart rate or we want to dilate the bronchioles. And you might be able to think of some conditions in that. One common one would be asthma, where we want to dilate bronchioles. Now, the beta drugs, as a side effect, though, can also increase central nervous system stimulation. So in stimulating the central nervous system, you can see some things like restlessness, fine tremors, anxiety, and overstimulation of the heart, or tachycardia. So as a result of that central nervous system stimulation of the betas, those are some common side effects that you will see in people who are taking beta-adrenergic medications. Examples of these would be epinephrine, which was on your drug summaries, adrenaline, dopamine, and albuterol. And albuterol is a common asthmatic medication used primarily for that bronchodilation piece. So we talked about the medications that simulate the alphas and simulate the betas, stimulating both of those. But now we also have the contrast. Sometimes we need to give medications that antagonize them, okay, that block those medications or block those receptors. So that's what we're going to talk about in the next two sections. Medications that block the alphas and medications that block the betas. So we talked again, alphas, recall, the neurotransmitter that we're looking at with alphas that stimulates alpha receptors is norepinephrine. So if we want to block the alpha receptors, we want to try to block norepinephrine. If you take norepinephrine out of the body, essentially, or don't let the sympathetic nervous system receive it, what's going to happen? What is the effect of decreasing stimulation of the sympathetic nervous system? Specifically, think of decreasing the alpha adrenergic receptors. Well, what happens is we get relaxation of the smooth muscle, and this includes primarily those in the blood vessels. So now, instead of causing constriction of the blood vessels, if we block norepinephrine, we're going to cause them to relax. So now if you think about that, what's the primary condition, the main condition that we would use a medication that would block norepinephrine, causing dilation of the blood vessels? Hypertension. So in a hypertensive state, we want to go and relax the blood vessels. So we may use an alpha adrenergic blocker in this case. The side effects would be similar to those of decreased sympathetic activity or increased parasympathetic activity. So you may see things like constriction of the pupils. You may see an increase in nasal congestion. And the biggie, and we've talked about this before, would be orthostatic hypotension, whereby now we've relaxed the blood vessels and now someone stands up and the blood doesn't go to the brain fast enough and they feel faint. So what drug from your summaries was in this classification of medications? I'm going to let you hold on to that one and email that one over to me. What medication from your drug summaries was an alpha adrenergic blocker. Okay then, we talked about the alphas, so then we can't let the betas alone. We're going to have to deal with them too. So, the beta blockers, you should already be familiar with. What is the neurotransmitter that beta blockers interfere with? Epinephrine. And this should be very familiar to you because we've talked about these previously. Okay, and do you remember where we talked about these? Yeah, we talked about them when we talked about antiarrhythmics. Beta blockers, were an antiarrhythmic. It's the same medication. So we can go through these fairly quickly. If you recall, a beta blocker does what to the body? It decreases the activity of the heart. And we talked about this when we said it is primarily used for arrhythmias. We can also use it for angina or angina if someone's pain is due to increased activity of the heart. And in some cases we may use this for some hypertension, for hypertensive states too. Common side effects you might recall of beta blockers were nausea, diarrhea, and bradycardia, because we're decreasing the activity of the heart, slowing the heart rate down. And please remember, this is the medication we need to watch if someone has an asthmatic or a COPD condition, because beta blockers will cause constriction of the airways. So this is a medication, again, we do want to avoid giving to someone who has an asthmatic type of condition. Alright, so let's see how we're doing here. Couple quick questions for you. See how you're doing with comprehending these medications. So you have a patient and they're brought into the emergency room. Their blood pressure is 80/50 millimeters of mercury, okay, which would be considered severe hypotension, low blood pressure. What class of drug that we talked about here should be administered? In other words, what drug will treat, do we talk about that will treat severe hypotension? Okay, well, after some time to think, that would be the alpha adrenergics, something that would stimulate the alpha adrenergics. That would cause constriction of the blood vessels and bring the blood pressure up. Okay, so now the second question is, following cardiac surgery, the patient suddenly experiences a drop in cardiac function. Okay, the heart rate is slowing down. What class of drug should be administered? So in other words, what class of drug do we say would stimulate cardiac function? That would be a beta adrenergic medication. And typically, the one that's primarily used is epinephrine. And you may see that if you're ever watching an Trauma Life in the ER or a paramedic show where they're calling for epi. Give them a dose of epi. And that's what they're doing, is giving epinephrine to stimulate cardiac function. Okay, so with that, we have reviewed the medications that we use when working with the sympathetic nervous system. We looked at the pharmacological effects of alpha adrenergics and beta adrenergics, and then we also talked about the indications and effects of the alpha blocking drugs and the beta blocking drugs. Take some time, think through that, email me that drug summary, and then when you feel comfortable, move on to part 2 of our lecture series.